We can have our final panel come forward, and as we do, I'm going to make a couple of announcements in terms of, first of all, there's going to be a handout of the summary from yesterday that I did this morning, and that will be coming to your seats somewhere during the last panel and ways forward discussion. And then also PDFs of all the slides will be on the IOM website within 2 weeks. So those of you that were asking for them, they will all be there, and you can download them. Then the report from this wonderful day and a half will appear in about 6 months. Is that what we've been doing? And it will look like this, and you can again download it as a PDF. Should you want to have this on your bookshelf, you can also order a copy. And one of the ones I wanted to mention, I talked about all of them before, and they're in your materials, but we've talked a lot about the costing kinds of issues. And this one that was on the social and economic costs of violence is a good one to start to frame some of the costing studies that you all are going to be doing. So my final panel is not making their way here, so if you would come on up so we can get started with the Ways Forward panel. And Audrey, would you be willing to put what we had from this morning, the third slide, up so people can look at that and I don't have to reread it? And what I'm going to do is I'm going to ask each of our panelists, all of whom have been introduced before. You've heard from all of them before, so I'm not going to take the time for introductions. And I'm going to ask each of them to spend only 5 minutes in presenting one way forward, and you get one comment. So this is how we'll do the contributions from the audience as we go along. So Nelson, would you start us off? And there's a mic right there, so you don't have, or you can get up, whichever you want to do.
So the way forward, I think you need to make a clarification. Is this the way forward for the nations, or is it the way forward from the academy's perspective?
Well, in your position, perhaps for the academies.
Oh, for the academies. Okay. So one way forward for the academies, I think, is now that the academy, Uganda National Academy of Science, has picked up this topic together with the Institute of Medicine, and listening to the presentations, there's a lot that is going on. Not enough, but there is plenty. I think many of us in the room now realize that actually there's more than what we know. So I think the academies could undertake an exercise to summarize the evidence that exists in the region regarding the magnitude of the problem, the interventions that have been tested in the region, and show which ones work and which ones may need some further work. So summarizing the magnitude as well as the interventions that have been tested in the region.
And one thing I forgot to say is there is going to be a policy brief from UNIS that will be on their website, is my understanding. And so that will be another resource that you can use. All right, Tina?
For me, from a programming perspective, I think what we are dealing with is a very complex problem, and yet each action is quite important. So we do not have a magic bullet for it. But the thing is, we've had what works in many ways, and yet the problem is still very big. So it's still calling for innovation in many ways, especially around taking things to scale. How do we take the community mobilization models to scale? How do we work with the different sectors in terms of what is working from the health perspective? How do we take that to scale? And what is it that we are not doing right? Could we look back into ourselves? Maybe one of the things that I would really like to also talk about, like Nduku said, the whole bit of role differentiation. I think we've kind of gotten to know what is working. If we are working with the health sector, what is their specific role and the complementarity aspect of it? If it's the justice, law, and order sector, how can we start differentiating roles so that the work is realistic? I think those are the kind of partnerships that we should be going in. I won't say the specifics because I don't know what it is right now, but within this room and beyond, I think we need to be getting into collaboration so we can start that role differentiation, so we can do targeted engagement in terms of capacity building, in terms of influencing the structural changes, like for example, the procedures. What kind of procedures do we need per sector? How can we develop that? Thank you.
Hi, good afternoon. Right, as a way forward from a researching institution perspective, one of the things that has come out very clearly is that research institutions have a tendency of working by themselves, getting out results and expecting that somebody will take them on and be able to move on with them. What we're learning is that is the wrong way of doing research. We need to have collaborators within the community, within the other sectors, so that we do the research together, we get the results together, and then we use those results to have programs. But in order to be able to successfully program, we also need to have a collaborating partner who is going to be the lead agency to make sure that we have an anchor, as Nduku did say. I foresee barriers because we're used to working in silos, but I think we need to break that mode of working so that we're able to work together and then develop the priority areas as has suggested Nduku together. Otherwise, we're not going to be successful.
Thank you. Good afternoon, everyone. I'll also look at this from a research perspective, but focusing on a particular strand of research because it's evidence I didn't hear much of in the last 2 days. And that is, for want of a better expression, the perpetrators. And we heard a lot about the prevalence, we heard a lot about the outcomes, we heard a lot about measuring impact of interventions in terms of community level outcomes. But we didn't hear much about why some men, some women practice violence regularly or occasionally, what types of violence, and then we didn't hear either about whether those men and women changed as a result of the interventions. And I put this as a challenge because a way going forward because it's a way we haven't really seen much research analyzed that way, and I'm hoping we have the data to analyze it that way. And I'm making this point because we've heard time and again over the last 2 days that IPV is a socially acceptable norm. It's hard to break down, and the interventions we've seen that are being put in place to address it are interventions tailored towards addressing a social norm. So at the risk of being provocative, if it's a social norm, why aren't we seeing 99% levels of IPV? We're not, because not all men practice violence, not all women practice intimate partner violence. And so I think we have to think a little bit about how we're both conceptualizing the practice of IPV as a social norm and the way we're undertaking research and analyzing that data, because otherwise we may be not only not getting at some of the crux of the matter of why some people are violent and some aren't, but also that it may well inhibit what we're able to do to try to reduce violent practices amongst those that are violent. What can we learn from those that are not in violent relationships, either the woman or the man? So for me, that was a gap, and I think it's something going forward it'll be helpful to address.
Thank you, all of you. And as moderator, I'm going to add one more way forward for myself. First of all, we heard this morning the results of 2 incredibly important RCTs that were done right here in this region that break new ground globally. Both the SASA trial and the SHARE trial, for the first time, both of them very different kinds of trials, but showed changes. The SHARE trial not only in reduction of IPV, but also reduction of HIV/AIDS incidence and prevalence. That's the first time globally there has been a rigorously designed RCT that showed those 2 results. So that those results are in the process of being published. When they come out, I would urge this region to take very good care of the disseminate it widely, and also to replicate it and conduct the kind of cost effectiveness analysis that we've been hearing about needs to be part of the way forward. The SASA trial also is going to be coming out almost any minute, and that too needs to be disseminated widely. And although there's an economic analysis, I understand, underway, that's going to be very important to do, and to disseminate those findings and replicate them in the region, and for both trials in terms of how they can be replicated in other countries in the region. And then we also heard from the MENKEN strategy in Kenya, and that also, although it's not as mature, we say, in terms of evidence that there's effectiveness of that particular strategy of engaging boys, not boys so much, but men particularly. But there is some formative evaluation going on that can be built on, and hopefully there will be that kind of rigorous evaluation that's done for that intervention too. So I would first of all take great pride in what's happening in this region, and to build on those results of those 3 intervention strategies. All right, now